Good afternoon. My name is Mark Hanin, and I will be presenting my research project titled Africa in Depth, Policy and Health under the guidance of my faculty mentor, Dr. Kalechi Kalu from the Department of Political Science. I want to begin by asking a question. What are health disparities? According to the NIH, health disparities can be defined as the differences in the quality of healthcare that are not due to access-related factors or clinical needs. That means the quality of healthcare you get while in a clinic as opposed to the quality of healthcare you get while in a hospital is not an example of health disparities. In fact, health disparities are much deeper than that. To understand what health disparities are, you must really understand its causes. While performing my research, I was able to discover that there are multiple causes for health disparities, but the main ones that I chose to highlight for the purposes of my research project were race and ethnicity, geography, human health, education, socioeconomic status, and economic status. The reason I selected these causes to highlight was because I wanted to discover what were the living standards of of certain countries. And I believe that I will be able to do so by understanding what the infant mortality rate of the country was, the level of education of the country was, the percent of the workforce that was skilled, the gross national income or GNI per capita of the country, and much more. And one thing I was able to note through my research was that all these causes were intersectional with one another. That meant that disparities in any one or all of these causes will have an effect on the other. What does intersectional mean? Intersectional or intersectionality can be defined as how multiple forms of discrimination, such as racism, sexism, and classism, can aggregate on top of one another or intersect, especially in regards to the experiences of marginalized individuals and groups. And why is this important? And why use intersectionality? In the same way, I was able to determine that there were multiple causes for health disparities to begin with. It was a reasonable it was reasonable to conclude that there can be an overlap of any one or all of these causes, and that would make it more difficult for already marginalized groups to have fair access to healthcare services. My project is titled Africa in Depth, Policy and Health. The reason I have titled this project in that manner was that I will be comparing two African countries. One that struggles in providing its citizens with an adequate living standard, while the other does more a better job in providing its citizens with an adequate living standard. The country that struggles in providing its citizens with adequate living standards for the purpose of my research project is Nigeria. And to understand why Nigeria finds itself in the position that it does today, it is really important to understand its history. Shortly after Nigeria gained independence from Great Britain in 1963, it entered a period of civil war from 1967 to 1970, where the Biafran people threatened to secede from the northern Nigeria federal government and form their own state. And as a result of the civil war, there came to be a distrust in the federal government that still exists to this day. Because of that, Nigeria does not have an effective healthcare system or effective public health policies. With that, it was reasonable for the federal government at the time to regulate all aspects of the healthcare system, whether it be orthodox care that focuses on treating the symptoms, traditional care that focuses on treating the whole body, or alternative care that focuses on utilizing alternative medicinal practices such as herbal medicine. Nigeria has implemented a policy where it favors indigenous hires. That means favoring hiring healthcare professionals who have gained their education in Nigeria. And while that may be a positive, the setback behind that is that healthcare professionals with Nigeria are undersourced and undertrained, and as a result, find difficulty in dealing with pandemics and epidemics. An example of which was the Ebola epidemic that struck Nigeria in 2014 and the difficulties that ensued as a result of the lack of preparedness for the healthcare providers at the time. A final aspect of Nigeria's healthcare system that was viewed as problematic as a result of my research was the inequity of healthcare worker distribution. This is because a majority of healthcare workers in Nigeria are concentrated in urban areas. However, a majority of the Nigerian population, namely 52.2% of Nigerians, live in rural areas where poverty is prevalent. And as a result, the distribution of healthcare workers in urban areas can be seen as problematic. The other country in which I hope to provide Nigeria recommendations with, based on its actions and what has implemented, uh, is South Africa. To understand how South Africa was able to attain its status as a role model country in the continent of Africa, it is important to understand its historical context. And specifically, it's important to understand the apartheid time period, a dark time period in the history of South Africa from 1948 to 1994, where racial segregation was legalized and where Black Africans did not have equal access to to education and health services as white Africans at the time. Although South Africa has gone a long ways and has accomplished much to help reduce the disparities in health and education, there still exist disparities in employment opportunities, most notably with Black Africans having higher unemployment rates than white Africans. Specifically, 36.5% of Black South Africans being unemployed as compared to 8.8% of white Africans being unemployed this past year. South Africa, unlike Nigeria, South Africa has the coexistence of two health sectors, the public sector and the private sector, where 84% of South Africans rely on public sectors, which are government-funded hospital and clinics, while 16% of South Africans rely on the private sector, which are privately funded hospitals and clinics. South Africa also has a policy that it implements that helps combat the disparities in healthcare services, and that is Section 27. Section 27 of the Bill of Rights of South Africa states that all citizens are guaranteed access to healthcare services. And a final feature of South Africa that makes it a role model to the African continent was the establishment of a professional health council registration requirement, where all healthcare professionals in South Africa who graduate from professional school are required by law to register to their applicable professional health council under the South African National Ministry of Health, thereby ensuring that the South African government is able to keep track of all healthcare professionals and promote an exchange of expertise among the different professionals, most notably by signing a memorandum of understanding between Great Britain in the 1990s to combat the crisis of migration of South African healthcare professionals at that time. The methods that I have utilized to conduct my research projects were three measurements, the first of which was purchasing power parity, PPP, which relies on the power of a nation's currency as compared to another country. The United Nations Human Development Report indicating how well of a job a nation does in providing opportunities for its citizen. And finally, the Human Development Index, HDI, which is a quantification analysis of which is a simplified quantification analysis of the Human Development Report. PPP, or Purchasing Power Parity, standardizes the measurement of all currencies in the world to one reference value. Specifically, in his 1996 journal, Kenneth Rogoff relied on the United States as a reference value for purchase power parity. And that would mean that for every 100 US dollars, each Nigerian naira would cost 3.9 US dollars. And for every 100 US dollars, each South African rand would cost 17.2 US dollars, evincing how South Africa has a higher PPP than Nigeria. It is worthy to note, while I may be using the United States as a comparison, that it is not applicable for the purposes of this research, as it is an outlier and simply used as a reference. The second method I have used, the second data I have collected was set of data I have collected was the Human Development Report, specifically the 2020 United Nations Human Development Report, where I looked at four aspects of metrics which I believe were accurate to determine a country's living standards, which were health, education, socioeconomic sustainability, and economy. While looking at human health, what I have noticed was that the infant mortality rate of a country correlated with the life expectancy at birth. Simply put, the lower the infant mortality rate of a country, the higher the life expectancy at birth. And this is because when citizens are able to be provided with advanced medical care at such an early and critical stage of their life, namely the natal stage, they're expected to live a longer life as a result. And not only that, nations that have greater life expectancy at birth are able to spend a greater proportion of their gross domestic product or GDP on current health expenditures, as exemplified by South Africa having an infant mortality rate of 28.5 birth per 1,000 birth compared to Nigeria's 75.7, a life expectancy of 64.1 years compared to 54.7 years for Nigeria, and 8.1% of its GDP spent on current health expenditures as compared to 3.8% for Nigeria. Simply put, how long you live is controlled by where you're born, and that is because of the policies you live under that determine how much care you're able to get at an early stage in your life. It is important for citizens to be healthy in order to be able to enroll into school and gain education. If citizens find themselves unable to enroll in schools due to health complications, they miss out on years of education. Simply put, South African citizens have a lower infant mortality rate, and as a result, South Africans are on average much more healthier and expected to live much more longer than their Nigerian counterparts. And as a result, the level of education in South Africa in terms of years of expected years of schooling is greater than that of Nigeria. And that is specifically South Africa has 13.8 expected years of schooling as compared to Nigeria's 10 expected years of schooling. Though the means of schooling may be lower in both cases, it is worthy to note that this is because of disparities between education for males and females. By getting educated, you are able to attain skills and ability that will help you during your professional careers. So simply put, the longer you spend getting educated, the more likely you're able to accumulate new skills and ability that will help you in your professional careers. That is why South Africa is expected and to have a greater proportion of their labor force being skilled. Specifically, South Africa has 52.2% of its labor force being skilled as compared to Nigeria's 41.4% of its labor force being skilled. And finally, as a result of workers being more skilled, they're able to increase their productivity. And the increase in productivity on an individual level would translate to a higher income for that individual and greater wealth for the nation as a whole, as exemplified by the gross national income GNI per capita for South Africa as compared to Nigeria. Each South African citizen is expected to have a gross national income of 12,129 PPP dollars, as compared to Nigeria, each Nigerian citizen having, on average, a gross national income of 4,910 2017 PPP dollars. One thing to note as well is that though the GDP, gross domestic product of Nigeria, is greater than that of South Africa, this is because the population of Nigeria is much greater than South Africa. South Africa has a population of 55 million, whereas Nigeria has a population of greater than 100 million. And that is because Nigeria is the most populous African country. Simply put, how much wealth you can earn as a citizen can be dictated by where you're from and your nation's wealth. And a final metric that I've used as part of my methodology was the Human Development Index ranking, or the HDI ranking, which is a quantification assessment of how each nation was able to do its job in advancing human development. And advancing human development in terms of allowing citizens to learn to live a long and healthy life, to be knowledgeable, and to live a decent life in terms of economic and financial security. Specifically, the HDI ranking of South Africa of 114 ranks significantly higher than Nigeria's HDI ranking of 161. And that is based on the Human Development Report and the statistics that were produced wherein that I was able to collect for the purposes of my research project. Some of the solutions I suggest to help the Nigerian government follow the South African model is to increase governmental support of healthcare professionals, and not only healthcare professionals, but to increase governmental support of individual civilians. It is important for Nigeria to provide healthcare professionals with the Nigerian government. It is important for the Nigerian government to provide healthcare professionals with the skill they need to care for civilians at an early stage, such as the natal stage, so that they are able to live long and healthy lives, which would translate into greater years of education, which translates into the ability to develop greater skills, which translates in the ability to increase productivity at the individual level, contributing to a nation's overall health. So it is important for Nigeria's government to support healthcare workers in that regard, as the intersectionality of health disparities is at play as a result. And not only that, it is important for the Nigerian government to support educational programs to increase accessibility and make education free for all civilians at the primary and secondary level. Another solution I propose that Nigeria should implement, as according to South Africa, is transparency to increase the civic engagement and the skills that citizens have and their awareness of issues that impact them. Having the ability to be more competent and more aware of the issues that impact everyday life will increase engagement and productivity and to today's society. And that is because individuals rely on knowledge to be able to contribute to their nation as a whole. And a final solution I should believe that Nigerian government should implement based on what South Africa was able to accomplish was to advance human development. It is encouraged for the Nigerian government to provide more opportunities for its citizens to make choices for them to be able to gain more education, for them to be able to gain more skills, for them to be able to be more prosperous as individuals, and for them to be able to contribute much to their countries, to their country's wealth. As a result of the COVID-19 pandemic, I was reduced to being able to having to conduct my field work in a remote environment. Specifically, I decided to conduct my own global webinar series called the Promoting Health Literacy Webinar Series. And that was where I bring in healthcare professionals from around the world to discuss public health topics that are relevant to the current times we live in. And some of the topics in which I was able to bring healthcare professionals from around the world to discuss involve telemedicine and healthcare financing. Specifically, I hope to evince to my international audience how relying on telemedicine can help reduce um, public health can help reduce health disparities, and that having the ability to make decisions on how to finance one's healthcare is another way in which they can also reduce health disparities alongside telemedicine. And what makes this webinar series even more significant was that I brought speakers from underrepresented groups, specifically from Nigeria and South Africa, as I valued allowing my international audience to see themselves in the speakers who I got for the webinar, to be inspired by what the speakers had to say, so that they're able to impact their communities and share the knowledge that they were able to gain through my webinar series. As a result of my webinar series, I came to promote the United Nations Sustainable Development Goals. Specifically, they are abbreviated as the UN SDG. The United Nations Sustainable Development Goals, or the UN SDG, are 70 goals developed by the United Nations in 2015 after the expiration of the Millennium Goals to as part of its 2030 agenda for sustainable development. And that can be seen, which at that time was seen as a blueprint for peace and prosperity. The goals that I was able to promote while conducting my fieldwork with the webinars here, one of them was the third sustainable development goal of good health and well-being. By providing citizens with important information in regards to telemedicine and healthcare financing, I was able to provide them with life-saving information and the ability to make informative decisions in regards to how they can access telemedicine services in addition to financing their healthcare system in a way so that they are able to pay their bills and that they are able to provide services and to promote a healthy lifestyle as a result. The second sustainable development goal that I was able to promote through my webinar series as part of my fieldwork for the research project was quality education. By bringing in international experts from around the world to help educate my audience on different public health topics that were relevant to the times, I was able to provide this information free of charge. This was a way in which I was able to promote an inclusive and equitable quality education for all, where I was able to provide lifelong learning opportunities for my audience by providing them with videos of all the webinars I have conducted, sending it to them so that they can rely on it as a resource, free of charge and accessible at the stroke of a button. The following are my references and findings for my research project, and I would like to acknowledge all those who have helped me across my journey through my research and webinar series with my faculty mentor, my public health research advisor from the School of Medicine, and all those who spoke at my webinar series, the Millennium Campus Network that helped me advance the United Nations Sustainable Development Goal, the Just Health web publication affiliated with the Stanford School of Medicine, the partnerships I was able to form with the International Federation of Medical Students Association, Let's Talk Health, and the Pan-African Health Systems Network, university honors, and most importantly, my family for helping support me in my journey throughout the way. Thank you all.